All right, here we go. Nevertheless, where we left off. Okay, the business item. You know your test schedule. We got the practical for whatever, the 29th, right? Whatever that is. Okay. When do you want to do this lecture test? I don't care. I mean, if somebody has to be away for sports or something like that, different story. We'll make arrangements for that individual person. When? When do you have? What do you want to do it after or before? The practical. You tell me. After. We have a vote for after. Everybody, we have a. Do you want to wait? We want to have it 2 days or 3 days? You want, in other words, you want to have it that week? You want to have it the following Monday? Would that work?
Perfect.
I'm good like that. The problem is this: we're done with the material. See, it's about a week and a half unfresh out of your mind. Okay, I'm good with that. Okay, but eventually, sooner or later, there's always a price to pay. The longer you delay, like we'll only probably have one grade before midterm, and that's common for me. I'd rather test later than earlier and get some momentum going for the term. That's me. So I'm good with it. Yes, ma'am.
Is our lab final, since like the Monday is still classes, is that when our lab final is going to be, or is it going to be the Monday before?
It would. No. Theoretically, it could be that Monday. It will not be the Monday before. You mean talking Monday of finals week?
Yeah.
Oh, I wouldn't do that to you.
No? Okay. So
I mean,
we
I
won't
could, but
have-
the reason I wouldn't do that to you, I don't think it's fair. And frequently, depending on how well I like you, we may make that final a take-home final. So, I know. Do not tell your roommate. Mum's the word. Mum. Anybody ever watch Galaxy Quest? I just gave up. Go ahead.
So the study guide you gave us was for chapter 5 and 6. If the test is October 6th, is it still only going to be those two chapters?
Exactly. So I mean, no, there's a little bit, there's a smidgen of chapter 1. So, negative feedback, positive feedback. That's on there too. If you have 5 questions or so. So minimal. So you devote your energies to, it's a skin and bones test.
Yeah.
Does that work for you? I'm a soft touch. I am not like someone else who teaches those other classes, who's a hardliner. What a wonderful teacher. All right, moving on. Now, so where we left off last time, this is the hormonal controls. We revisit this in endocrine, we revisit it in kidney. So a lot of the stuff gets revisited during the course of the term. This is some physiology along with the anatomy, and that's inevitably what we see in bones. Let me get over there. Apologize. So hormonal control is calcium. Calcium is such an enormous player in everything in your body. I mean, nerves, muscles, your heart, blood clotting. So 99% of the 1,200, 1,400 grams of calcium are found in bone. So bone is the bank for all that. That's a lot of calcium. So again, this sort of dovetails a little bit into what you got. 3 main players for calcium metabolism. Parathyroid hormone, or PTH. Try to use what are uniform acronyms or abbreviations. You have to use them. Because you have to get, because those types of things you might see, not just my exams, but other exams, GREs, entrance exams, stuff like that. Parathyroid hormones increase blood calcium 3 ways. Number 1, out of bone. Activate osteoclasts to resorb bone substance, and in doing so, they liberate the calcium. The calcium deposit is dissolved in the plasma, voila, they elevate. So it's that delicate calcium, you need calcium, principally pull it out of bone. They also, another way we elevate it, that's part of making sure we have a continuing supply of calcium, is through our GI tract, or gut. Okay? PTH, it has to have vitamin D. Vitamin D is extraordinarily, that's why getting sunlight, we talk about osteoporosis is so important. Vitamin D, and there's no advantage about that. too much, but a really modern theory today, vitamin D supplements are important. If anything, it should be on the high end, not the low end. When that going forward, hear me say it again and again. Higher levels of vitamin D than quote unquote normal levels are adventitious and have a correlation with avoiding bad things like prostate cancer, breast cancer, which is common, other than skin cancers. So we take, we get lots of people get vitamin D easy all the time, tiny little gel caps that you can swallow through your day. Super easy. And the kidney, and this will elevate calcium because you're absorbing from the gut, and the kidney reclaims it from what's called a filtrate. Filtrate eventually becomes urine, but it's filtrated until we pull all the stuff in or put all the stuff out. Those are the three ways parathyroid hormone works. Vitamin D works with it, as I said before, in the gut. And the other hormone you're going to learn about is still an endocrine. It's called calcitonin. It's made by the thyroid. Thyroid and parathyroid are effectively next to each other, part of the same mass, but totally different places. So the thyroid principally is responsible for thyroid hormones, which nearly all of your cells rely on to keep producing, metabolizing at the appropriate level. Like, it's like the engine idling the right thing. It's a good analogy I have found over the years. Calcitonin is the oddball. It's very active in growing bone. It tends to put the calcium in the bloodstream into bone. Most authors, may not be disagree, but there's no uniform opinion as to whether it actually works after childhood, and if it does, is it useful in treating osteoporosis? So for the time being, just understand that calcitonin is, we're not sure how powerful it is. We know it's more active in growing bone, and probably would be, I think it's being used to some extent to try to treat osteoporosis, which is such a big problem today, such a large problem. So here's the parathyroid hormone, low, and it's, negative feedback, calcium levels are low, osteoclasts resorb, released, secretion stops when, it's the same negative feedback. As soon as we get more calcium, it slows down the parathyroid hormone. Interestingly, as you'll learn in endocrine, the parathyroids are essential. You can do without thyroid. Okay? Hold on. Let me just answer this real quick. Pain in the neck. Got it. It's a message. That was a message from the Almighty, my wife. I want to have safety when I get home. Calcium is released into the blood, okay? And as I was saying, the parathyroids we can't do without. Thyroids you can replenish. We have people have been using replenishment with thyroid supplement for a very, very long time now. That's a therapy that's been around for a very long time. So calcitonin, it's called, they have their fancy name, they're called the parafollicular cells, responds to high blood calcium levels. This is, again, it's a PowerPoint. All the readings I have done about it, again, the consensus that I have read suggests it's very active in growing bone, unsure in adulthood, you and I. When they use these stupid things, I don't do them. And so all of these things, in general, we'll get to more of it when we do physiology, into the specifics. So we want to paint with a broad brush. Low calcium destabilizes things like nerves and muscles. Hypercalcium, okay, makes them less responsive because we're relying on calcium channels. And you're going to have you talked about a little bit about calcium channels and voltage gated? And no, you have a little bit? Yeah, we're going to get into that in detail in physiology. Calcium is such a big player. And so the big problem with calcium when there's too much of it, we see this a lot when people have excessive amount of calcium in the bloodstream. There's a lot of different, cancer can cause it if it goes to the bone. It'll cause a lot of destruction. There'll be calcium. And when there's high calcium levels, there can be something called dystrophic. There could be something, I beg your pardon. This is not, I'm not going to ask you about it, called metastatic calcification. So effectively, calcium will start to deposit in areas that is unexpected. The most common type of calcification we call is called dystrophic, dystrophic. When a blood vessel that's really far gone, when it gets calcified and rigid, it's already, the inflammation has damaged it, and the calcium cells in damaged tissue. That's dystrophic calcification. That is a more common kind. Metastatic is less frequent. So, I mean, and the trouble is, well, wouldn't that be a good sign to see if somebody's getting sick? The reality is we don't see calcification in blood vessels till the blood vessels are about 75% gone. That's a problem. So a lot of times the visible sign comes, it's a barn door and cow. The cow's already out. You can't reverse it. I love those cliches when they apply. Now, one day, one of you will all simultaneously laugh at the jokes, and I will be a happy camper. Calcitonin, again, effects are negligible, glucocorticoids and vitamin D, yeah. And so these are other things. So it's indirectly, I wouldn't get crazy about that for now. Here's the Wolf's Law thing, all the little nooks, crannies, things that stick out, holes, weight bears on them, bones grow, remodel, and response. So you have a combination where they bend, they get thicker to resist cracking. Where they stretch, they get thinner to resist cracking. So it's a nice balance. The amount of bone stays uniform. It just gets sort of redeposited elsewhere. So compressing on one side, stretching on the other. The shaft is thickest where it bends, and because they're hollow, because compression and tension can cancel out each other. And that's really what happens. So mechanically, it's like that. I mean, it works in that regard. So typically, we in the dominant limb, we'll see use. In the upper extremity, we'll see whatever your dominant hand is. Relatively speaking, we'll see widening there. We can analyze gait, look at injuries. There's all sorts of things that point to it. Occupations. And here's the whole thing with handedness. Curved bones are thickest where they're most likely to buckle. So when we look for stress fractures, that gives you a clue. We look for and I remember in regular x-rays, I talked about this before, that honeycomb pattern, we call trabecular patterns. We look there for signs of stress. And again, as you might imagine, those big bony landmarks that we're going to talk about on Monday, when we get to the lower extremity, the greater trochanters, weightlifters, the more that they become so prominent, remarkably so. It's a really extraordinary definition. And then by the opposite of that, from lack of use, they begin to atrophy. So they're very indistinct. So it's usually a fine line between the two. So you can get, not so much maybe forensically, but studying bones been around forever. Very, very interesting when they discover, all those types of things. This is interesting as well. Mechanical stress. Deforming bone pushes fluid containing ions through the little canaliculi, and so an electrical current release chemical message, perform formation of bone. If you did not know, I do not know if it's still employed today. I mean, I haven't treated a patient in 25 years. When I was in school, in the late 60s, Hustle University of Pennsylvania, major center, U of P, in Philadelphia, came up with electronic bone healing, and we started to incorporate it. When they had fractures that were reluctant to heal, or we were suspected it would become reluctant to heal, they would incorporate a couple of plates with a plug into the cast. And basically, they'd have the person, I mean, you could have a battery pack, but by and large, you only had to do it for maybe 8 to 12 hours. So they have a long cord, and they plug it in and sleep with it at night. And even when they got out of the cast, they had like you could put something on at night and, Velcro it together. And effectively, and I had patients who used that too as well. So electronic bone healing was something that had a lot of attention. I do not know if and the whole idea was this. You were redirecting the flow of charged particles to accelerate healing and put bone where it was supposed to be. It occurred in things that we call non-unions. And if you are a bone surgeon, you work with a bone surgeon, you're a PA working at orthopedics, or wherever you're going to be, physical therapy, that's a swear word. It's like a golfer saying shank. You can't say that. It's a swear word. Okay, that's it. Non-unions are what people go up and go 1-800 call Edgar. All you see are this is the biggest injury law firm in the freaking world. Blah, 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 blah. I was on the business end, the wrong end of 6 different lawsuits. Not easy. Beat one, got out of another one, got clobbered in one. I testified under oath on a guy's behalf so he could get disability. When he didn't get it, he turned around and used all that I had testified under oath to sue me. Only unethical lawyers do that. I was stupid. I was very young. I been in practice for 6 years. You can't say something under oath and then retract it. We have a word for that. It's perjury. My insurance company will pay. I'm not going to jail. So controls determine whether or when remodeling occurs in response to changing calcium levels, mechanical stress. Fine, on with the show. The good part, thank goodness. Don't let anybody tell you, oh, I got x-rays, I only had a crack. It's not a fracture. Or it was just a chip. It's really not. They're all fractures. Fracture means it's a loss of the integrity of the bone, whether it's visible or not, whether it moves or not, whether it's substantial all the way across or not. It doesn't freaking matter. If the integrity of the bone has been violated, it's a fracture by definition, whether it happened because of physiological factors, like say with aging or osteoporosis, or invasion by a tumor, or was trauma. It doesn't matter. So understand that, number one, the hit parade. I'll buy this. For young folks like you, most of the time, it's from trauma, whether it's sport, whether it's an accident at home, a vehicular accident, running around chasing your kids. Oh God! Invitation to I got a bucket handle tear in my medial collateral ligament picking up toys at the Y when my boys were a little before my daughter was born. So in old age, yes, something typically osteoporosis or something else that had caused problems with the bone. So if you wanted to broad brush it, it's a good way to look at it. This is where you have to understand. If you're going to do this, and some of you may aspire to do this in a medical setting, or at the very least, when all of a sudden, because nowadays, well, I don't know about you, when I get my UPMC or my Health app from AHN, I get all the reports from X-rays, from whatever, surgical reports, all that stuff comes to you now. It's all developed to you right away. Interesting thing is, it'd be nice if you could understand the parlance, because they're not going to explain it to you, they're going to use their own term. Talk about a fraction. It's very specific. Okay? So you have just doing a cylindrical diagram. You have the bone. Okay. So the question is, displaced and non-displaced is very straightforward. I mean, if it's just a crack like that, fracture line like that, and we'll get into that in a second, that would be non-displaced. You get a certain amount of displacement. So if we took that same, terrible artist, that same illustration, and it was just a tiny line in there. Even though you could see a space, it wouldn't necessarily be displaced. Displacement, depending on whether it's a child or an adult, requires a certain degree of separation. Children are a little more forgiving because they're not growing. So if displaced typically means in some way, shape, or form, it is not in a position. So we might take that same unit. So here's the fracture, and all of a sudden we've got something sitting over here. But now that's clearly displaced. what they didn't comment on is whether or not, these are relatively speaking aligned. Because again, we could have the same one here, and if they said displaced and angulated, you could have that same piece up here now. That, you know, but not only displaced, but let's say this is going this way, we have an angle. You have angle, so you have displaced and angulated, or you can have angulated and not displaced. This could be in alignment and just cocked over to there. So, I mean, you have to, so when you read these things, you get a report on you, somebody you know, and they ask you to read it and tell them what it means. If somebody took a course in anatomy, now you have an idea. Ends out of normal alignment, ends retain normal position. Displacement and angulation. They've incorporated the terms. Not a big surgeon. I drew there a complete fracture. Call that through and through. Remember, it's a cylinder on the outside. It's a hard cylinder that's effectively hollow, more or less. We call that through and through because we say it's through both cortices. I know it's circumferential, it's a circle of bone, but the reality is on X-rays it's just two-dimensional. It goes from this side and this side. That's a through and through or a complete fracture. Here, we'll call this line an incomplete fracture, not all the way through. Understand that you will see down the road in the X-rays they have on this PowerPoint sequence, you will see what is called a green stick fracture. That is different. Green stick is in growing bone, incompletes are in bone that is completed growing. Green stick, the analogy, like you're going to get firewood, and not that I would know this. Okay, you're going to get firewood and you snap it to see if it's green, kind of bends. That's really where it divides itself. I'm so out of shape when I go into the woods and things like that. I went cross-country camping when I was 20. See, the secret to that is I went with my best friend who was an Eagle Scout. Oh. Everybody's here. Nobody knows how to make a fire. He's like, hold on. Everybody's around our campfire. Going on the whole thing. To me, the single most important criteria. Open. Understand the word compound and the word open are equivalent. It's not complex. It's compound means this. The bone has been exposed to the air. It doesn't have to penetrate the skin necessarily. It does have to penetrate the skin. It doesn't have to be sticking out. There have been a lot of fractures where you instinctively, when you twist something, it's like, oh my God, you immediately respond by guarding it or flipping it back and down. Just think about when you sprained an ankle, oh shoot, like that. That bone could break, push through. And so if you see a skin that appears to be broken, you have to sterilely probe that. Whether it's a sterile Q-tip, doesn't matter what it is. Anything that you can get in there sterilely to see if there's bone that you anticipate made that cut in the skin. It doesn't have, and believe me, sticking out is an entirely different process. Okay? Sticking out would be obviously be clear. So the skin is penetrated, it doesn't necessarily imply that the bone has to be out there for the whole period of time. Once it has been exposed, bone is now infected. Period. Bone is a sterile environment inside. Once it's over there, and I don't care if you drop something on your toe, you stubbed your toe real bad, the nail came off, and all of a sudden, that nail bed we talked about, all of a sudden the bone under there is exposed. That is an open fracture. That requires three things. That requires antibiotics. That requires some degree of treatment covering it in some way, shape, or form. Most of the time, you're just using dressings on it, and that requires tetanus prophylaxis. Okay. In other words, if you're a tetanus current, not a problem, but that becomes immediately a tetanus-prone wound. Any open fracture. So if you're in a clinical environment and you see something like that, I mean, the second thing, when I see a cut or anything like that, the second thing I ask them, okay, is, when was your last tetanus shot? And be careful that your job, well, I had one 2 years ago. That is patient states they had tetanus prophylaxis 2 years ago. That, you're not doing your job. The next question is, oh, really? Where'd you have the shot? What happened? Did we take care of it for you? At that point, what's your basic benefit? Yeah, I was here. I'm pretty sure I had it here. Now you can go back and check records. As you get older, like I am, you're tired of getting shots. You just tell the doctor you had a tetanus shot 2 years. I'll leave you. It's exactly what happens. Your job is ask the question, record the answer. Doing your job and doing your job well are two different things. I say that to you sincerely. I tell all the nursing students the same deal. Your job is to take care of it. Sometimes people are reluctant. First, we first got the dog, something dropped. It wasn't him, it was me, and he's just away. Dropped on my foot, I'm barefoot. I should know about the feet, for heaven's sake. I went over to Passive in North, who lived in Cranberry. And the doctor said the same thing. You need a tetanus shot. I said, it was just 2021. I said, I know I have one. I know when I had one, 2019. Well, maybe you should still listen. Doctor, here's the deal. I promise you, I will go back when I next see my family doc and confirm I had a tetanus shot in 2019. If I didn't, he will give them to me. I'll even come in and show you. But I don't want to have an extra shot if I don't need an extra shot. So that's the idea. But so that's a useful thing to keep a record of. So you can say exactly where it was at that point. And same thing for information. Simple doesn't mean it's not going to cause significant problem. It means the skin has not been broken. I mean, I've seen fractures where the foot's pointing backwards, but the skin was intact. I mean, that's going to be a mess. A patient of mine, who I treated for many years, I had to refer him down here to Presby. His heel was so bad. He was a truck driver. He jumped off the back gate. He's done it 1,000 times. Just this time, probably a guy, mid-40s, early 50s. Crushed his heel. He just must have landed on it funny. He doesn't even remember. The pain was so bad. I mean, the entire calcaneus was in pieces. I said, this is way beyond me. I said, I know this is a mess. I sent him down here to the guy. He was at Presby and went to AGH, or AGH went to UPMC, whatever. He was a foot guru. And thankfully, I mean, he was able to get back to work limited. When you know things, you're taking care of people, you know it's beyond your scope. Don't be the hero. 4 little letters. Help. With it. I know I'm being. Understand, this is a rule I didn't know. DFU. Don't FU. Don't F up. I have authority on authority. So we describe all of these things that are there as part. So that's the introduction to what broken bones are all about. And it's fascinating. I had the privilege and the opportunity to work in an inner city hospital as effectively a general orthopedic resident for 2 years. Even though it was not in my field, we were the residents. We did surgery residents, orthopedic. We loved orthopedics. So we just loved broken bones. And when you're in a city hospital, a small inner city hospital, I mean, it's just like in the movies. You know, somebody would drive up, they throw somebody out of the car, gunshot, stab, giant traffic accidents would come your way. It was just crazy. Open fractures the first night I worked ER. First night. I had not 1, but 2 open hip fractures. 2 cases were femur. Longest and strongest bone in your body was exposed to the air. 1, an elderly man was up on a roof. This was early November of '77, off the top of my head, because I know where I was covering for the residents. I was a junior resident. And an older man was roofing on tarring a roof, fell off, and came in. Everything was distorted. All I saw was femur sticking out. This could show you how bad when things go from nothing to everything right away. 20 minutes later, a guy from a pizza shop came in screaming and yelling, "I've been shot." Blah, blah. We really didn't see anything per se. I was like, he was just going crazy, this poor middle-aged guy. And finally, we're like this, and we're trying to get him. I see one of us noticed, I don't know if it was me or somebody else, blood back here. So what do? You can't get his pants off. You can cut him off. And as I cut off I started to lift his foot. There, I see it. bullet wound, right into the femur here. 2 open fractures inside 20 minutes. I probably came in about 7 at night. I think I left the hospital at 4 in the morning. I'm calling up doctors in the middle of the night for orders. My attending, because it's a great fear, they if they're going to call in my attending, and if I didn't even get a chance to make the decision, the ER doc says, "Oh, by the way, I called the orthopedic surgeon on call." I'm like, "What? Saturday night? He could be anywhere." And the first he walked in the door, looked at the X-rays are up. I didn't even see him walk in. I was so busy running around checking. He goes, "Lou, you were right to call me." Life is good. Then I knew I was a hero. Rather, I was either a hero or a zero. Absolutely true story. So I left. He had 2 guys up at OR. I'm busy writing notes, calling doctors. He already has them in traction. In those days, we put everybody in traction. 50 years ago. As he walks out at like 3 in the morning, he goes, "Lou," he said, "What?" I said, "What do you want me to do post-op for these patients?" "I want you to write every order you can think of for both of them before you leave, and call this consult, call the neurosurgeon, call the this, call the that." Oh my God, we're going to head trauma. Crazy. Ladies and gentlemen, if you saw it, won a whole bunch of Emmy awards. If you get a chance, get HBO Max. If you know somebody, watch The Pit. Same stuff. That's exactly what's happening. It's a very clever idea, but that's it's crazy like that. Voila. We'll start here. You're pretty good. What I've drawn for you, the typical fracture, a fracture, normally there's 1 fracture line. There's 2 pieces. If you have a 3rd fracture line, you now have more than 2 pieces. Whether there's a 2, 3, or 63 fracture lines, they are all the same. Means comminuted. Bone fractures into 3 or more pieces, 2 or more fracture lines. Typically, it happens in long bones. Yes, it's more common in folks who are older. This is not an older looking bone. It's pretty good looking ossification. In other words, I don't see evidence of osteoporosis. The calcium levels look good. But I've used this slide for a long time. Look at where this is. That's like man versus cardinal. If I look at that, because we saw those, somebody walks and said, "Wham!" Right? See something like that. There's no way to tell if that's a hard management case, because once you start little pieces like that separated from the rest of the bone and the blood supply, they couldn't close. So you're probably holding it together more than anything else. You probably wait till it starts to heal to determine how you might hold it together long term. Some type of internal marker. So if that was open, you would treat it differently. That, particularly common in the age whose bones are more brittle. I'll go ahead. So that would be a good example. If you want brittle, next one. Ladies and gentlemen, that is osteoporotic bone. That is what's called a compression fracture. Where I showed you in lab, as best as I could with the intervertebral foramina getting pinched. You see that here, wide open. But once you get this, all of a sudden the next one being somewhat obstructed. So that's people get them all the time. They're more common than you think as you get older. It's not funny. It's not the incredible shrinking grandmas exactly what that is. That's the illustration they had before with that lady with the hunchback and compression fractures. That's ridiculous. There's not a lot you can do about it. Really, you can brace them. You can try to deal with them if they're something that came from a fall or something along those lines. That's what you might look at. Like I said, when somebody falls, like that truck driver, when they hit, generally again, you X-ray the heels, low back to see if there was even a healthy bone, and the risk of people. It's like my wife and on Friday we were down. I know where it's in the falls near the Cheat River. She said it was all these steps going down to the base of the waterfall. It was gorgeous. Because the steps are like there for 100 years, up this way, 1 step wide, narrow. He just wasn't watching. I was being, I'm walking like this. She caught like a toe, boom, went down. Thankfully, her wrist was, just jammed, per se, because it gets a whole lot better. She hit ribs, which haven't been so good. We have important business this weekend. We're watching our great grandson. And if you were watching your great grandson, no, you're sure. Just saying. Here's another one. Sports injury. They call this a spiral fracture. And you're seeing it two-dimensionally, but I mean, it's not a bad illustration. You see what happens. Split, it's like a fracture with a twist. So, ragged break occurs when excessive twisting forces are applied to bone. Classic example of that, skiing, for example. So, I mean, if you had somebody who was skiing and, whatever reason, the boot didn't come out of the ski and they did a twist, you could imagine that would easily happen. And indeed, the classification, we learned a lot. A lot of the way to treat these kinds of injuries, particularly ankles that were part of this twisting and things like that, came from areas in Europe that did a lot of Nordic sports. Particularly the Swedes came up with a classification that would tell you how far the twist was. And the more you twist it, the next thing you better do is look up toward the top of the fibula by the knee, because that force has to go someplace. So there's a whole class, it's got a fancy name that you have to know, called Lagi Hansen. And so folks in orthopedics who deal with this see those and immediately know there's a classification system. Why we use classifications is it tells you how to treat them. It's like if somebody has a metastatic cancer that's 4A or 4B, it tells you what you have to treat it, or whether you can treat it, or what the prognosis is. So, I mean, there's a reason those rules are there. It tells you what antibiotics and how much and how frequently, whatever. That's why classification is so important. That, you could certainly see it in sport. You could see it easily. Somebody at a football game, they're twisted. They get for some reason, their spikes get jammed, and all of a sudden somebody tackle them, and the next thing you know, boom. Maybe one of those hip drop tackles or something like that. We talk about too much. Where is this unexpected and a problem? You saw this same fracture in a child. What would that imply to you? Kids should go skiing? You see a spiral fracture, everybody, in a child. That is criteria that you have to investigate as a potential child. I've got a lot of children, grandchildren experience. It's one thing if you're walking with your kid and you play 1, 2, 3 swing, you're both lifting up and go. But imagine that's not going to injure you, of course. You get that kid who you latch onto and they start to twist away, you don't get let go. Dislocate his shoulder. Twisting injury like that would be the same thing. They're trying to twist away. You see spiral fracture in growing bone. This becomes a significant legal matter if you're clinically exposed to it. Depending on your position, in a hospital emergency room, you would contact social services. You would at least report it to whoever is the supervisor and let them, you would have it documented. And then once you have documented, it's up to whoever is supposed to follow up, which sometimes is you. This is not an elective thing. I mean, and here's the frame, I'll give it to you. A lot of times you'll run into somebody, if you treat people, your next door neighbor, your best friend's cousin, Ralph, whatever. Somebody he was getting a little rowdy. We didn't know that. You don't have the luxury of not reporting it. Because if that happens again, and they go to another hospital and they start and the law gets involved, they're going to look for medical records everywhere. And when they find the medical records from when you didn't report it, or if it wasn't reported at your facility, you are now complicit. Particularly for children. The eyes of the court, the child cannot protect themselves. You have to protect the child. I'm being very serious with you. This is something, what happens is you let social services. I have the most wonderful daughter in the world. I mean, I always share anecdotes that happened to me. My daughter, when she was 4, my daughter got pregnant when she was 15 years old. She was an obnoxious, rowdy kid. She was sexually active. And she would tell her mother things that I just got so mad one day. I said, and I just went wham. Okay. Wearing a ring, cut her lip. They knew she was a pain in the ass. And then in this middle school, 8th grade, they reported. Next time I had social services in our house. We were all sitting there. I knew they were there. And they came in, and she gave the social service lady a tremendously hard time. Finally, all of a sudden, she came and she looked at my wife at the time, and I said, I understand why you hit her. I would have killed her. You're protecting the child. A lot of times the circumstances are, if the parents are not at fault, they're not going to be at fault. You just have to rely on the system to work itself out. To be exactly what happened to me. And my daughter's fabulous. Remind me to show you a picture. See a picture? Can I brag? Why? I'm not into crypto. And so we get along famously. But I mean, but she and her mom, it was like, and daughters and moms particularly have events. See if I can find it. Sooner or later, you can see the cat again. Cat's cute here. Just not going to offend everybody. Oh, it's not one of those pictures. But I'm saying, I mean, realistically, same thing. Grabbing kids by the shoulders can do it. My kids used to do this. They used to hook their legs. We had chairs where they sat at the table that had those, and they hooked their legs across the chair like this, and they bounce up and down. I mean, that would give them a spiral fracture. And we used to, I mean, we'd say 4 on the floor. Make sure all 4. I mean, they're kids. You can't win with that. I don't want. Here we are. This is when she got married in Cancun. Thank God doesn't look a thing like me. That was in February, where she was a soon-to-be 39-year-old grandma. She was out. Granny never looked that good. For me, that's the advantage of having adoptive children. They don't look like me. But to make the point for you, that's what I mean, these things. You have to understand that this is what experience teaches us. You've got to be so aware of these things. The examples with people in medical, particularly, when you see when you see somebody comes in, and I can't tell you how many times we had gals come into the ER who were, injured. Injuries were that fell down a flight of stair thing, teenage pregnancies, all that stuff. It's just as real. It happened just as much 50 years ago as it happens today. And they're going to give you the same thing. Legally speaking, I say this to you: if you're going to be in a licensed field, licenses are very hard to get and very, very easy to lose. That's the kind of thing that can lose you a professional license. The same way a DUI can impact you significantly. You get to this certain point, like you guys are all at that point now, where this stuff follows you around. When you're under 18, it doesn't follow you around. Once you're over 18, this is where the whole transcripts follow you around. It happens. And you have to start explaining these things. It's not easy. My middle son, who one day you'll probably meet him in here, because he's got sort of an on schedule. He lives over at Weirton now. I mean, it's been a long time, but I mean, he had a felony conviction back that was adjudicated in like 2005, 20 years ago. You have to constantly explain that stuff on work applications. It's not easy. He's had it for 16 years. He had an absolutely lily white record, thankfully. He drives commercially, and that's a TSA clearance. So TSA clears him, puts a lot of jobs. They don't care. He has a hazmat life for that kind of stuff. So please, I've lived it. Take it from me. Enough about me. I hope you got something out of that. I try to do these things to try to tell you how it's just the way life works sometimes. It gets you into different places. Everybody's lives are different, and believe me, if you heard anybody else's problems, you would take yours back. Life is like that. You hear stuff that every day. It's like my wife and I just go, I can't. But this is what happened. Somehow we managed to survive it, and she managed to survive it. So I'll let you know that. All right. Goodbye. It's Friday. We'll finish fractures. We'll finish bones. That'll be the end of the test material, I hope. We'll finish it. It will be the end of the test material in any event. Now, I have only 2.5